Thank you to everyone for tuning in today. My name is Ian Scott. I am one of the psychosocial oncology clinicians here at CancerCare Manitoba. I'm so happy you're joining us today and joining us for this patient panel that I'm very excited to get into. I'm going to run through a quick few slides that I need to run through before we get started, and then we'll get to the meat of the presentation and our panelists, which I know everyone is excited to see. So let me just pull up the slideshow here so that you can see. The Q&A function is, as always, open through this session, so feel free to make use of that. And I'm just pulling up my slides here. So here's our title slide, and we do go through with every presentation, as I'm sure you've already seen this morning. Presenter disclosures. I am a speaker at the Leukemia and Lymphoma Society of Canada, a group facilitator there. And I don't have any other disclosures for Kristen or Karen, who are our two panelists to discuss. And we always have this mitigating potential bias slide. I'm always one to believe that we need to be aware of our biases and our blind spots. I don't think we can always fully eliminate them, but I do find my facilitator experience, like I disclosed there, actually helps in facilitating a panel like this. And it's an honor to be here with these two lovely people who are going to share their stories with us. As well, here at CancerCare Manitoba, we want to make a commitment to health equity, which are differences that can create differences in outcome for health for people, but they're also modifiable differences that we can make changes to if we're equity minded in the practices that we carry as clinicians in healthcare. So it's something that myself and the presenters have spoken about and reviewed to make sure our presentation is equity minded as we go forward today. Here's what you're going to get to leave with at the end of this half hour. Believe it or not, you're going to get to hear the insights and wisdom of our panelists. They may be applicable to you, or their stories may be applicable to your scenario. You're also going to get to learn about issues you may not have considered. And you're also going to get to hear two wonderful kick-ass people talk about their experiences. So let's get into that as soon as we can now. So let me close this down. All right, let's bring our panelists on board. I'll get to introduce them one at a time. We've got Karen and Kristen. I'll start with Karen because I saw her name pop up on the screen first. So Karen is a mother, sister, friend, manager, and she enjoys playing sports, cooking, and baking, living life to its fullest. She was diagnosed with triple-negative breast cancer in the fall of 2021. Karen's journey took her through chemotherapy, blood transfusions, an infection, and ended with surgery in the spring of 2022. She has found healing through sharing her experience, advocating for herself, and living her best new normal in quotes, normal life after breast cancer. So welcome to Karen.
Thank you.
Hey, great. And Kristen, also joining us today. Kristen lives in Winnipeg and was diagnosed with stage 3C ovarian cancer in December of 2021 at the age of 34. She underwent a complete hysterectomy and completed 6 rounds of chemotherapy in April of this year. She currently lives with her husband, her 2 dogs, and her cat. Welcome, Kristen.
Thank you.
All right, so remember the Q&A function is open, but let's just get this started too, because there's lots of questions I want to ask these two folks. So we're going to just start with each of them providing a brief summary of who they are, beyond their bio, of course, that I just read, but also their diagnosis and treatment history, and where things are at today with their cancer experiences. So Karen, would you like to get us started with some thoughts on that?
Absolutely. Thank you for having me. Unfortunately, I'm not new to the cancer world. I lost my mom when I was 19. She was 42 to cancer. And then 2 years ago, I lost my dad to cancer. I was 44 at the time. And unfortunately, I ended up finding my lump on the 1-year anniversary of my father's passing, which put me in a bit of a panic, of course. But I am... let's get down to business and figure out what the heck's going on. So I made an appointment with my doctor the next day, went and saw them, and they, of course, felt the lump. It was, I think, about 3 centimeters, 2.5, 3 centimeters, and was sent for an urgent mammogram. And I waited and didn't get a call, and thought I need to take matters into my own hands. And so I called and called every day, twice a day, to see if we could get an appointment quickly. And 9 days after I went to my doctor, I was able to get an appointment and had my mammogram, which then turned into an ultrasound, which then turned into being sent for a biopsy. So the biopsy was September 29th. I found the lump on September 13th, and I was diagnosed with cancer, triple negative breast cancer, on October 6th. And so it's been a whirlwind since that time. I met with the surgeon on October 21st, who said, "You've got triple negative breast cancer, which is an aggressive form of breast cancer, and it just means that it's not hormone related, and so there's specific options for dealing with this type of breast cancer, which includes surgery and chemotherapy." So I was then referred to an oncologist after I had gone through all of the tests that need to be done and all of the screening. And I met with my oncologist on November 16th, and started chemo exactly a week later, which was November 23rd. I was scheduled to go 16 rounds of chemo. My body made it through 15 rounds. And as you heard in my bio, I did have some complications in the middle of treatment, but was able to get through it. I finished chemo, the big smile on my face, March 30th. And I then went through a single mastectomy with immediate reconstruction using my own tissue on May 10th. And on May 24th, right around there, I know all the other dates. For whatever reason, I don't remember the date that I got the good news that I had achieved a pathological clear response, meaning there was no there was no cancer in my lymph nodes that were tested. I had 9 of them tested and removed, and my full breast tissue, and there was no cancer. So it's been fabulous since that point, with the exception of still dealing with going through chemo side effects still linger, and having surgery. There's not that I had complications with surgery, but your body is still adapting to what it feels like after that. And then from sort of a next treatment perspective, I've opted to do something called zoledronic acid, which will help build up my bones, because my type of breast cancer does tend to metastasize there, which I will go through for the next 5 years, every 6 months, just a quick infusion back at CancerCare. So that's where I'm at now.
Okay. Thank you, Karen. It's like a whirlwind, and it's a lot to summarize in a short period of time. It's also interesting how some dates, like months and dates, just stick in people's minds. Some don't, but some people remember those certain days that they had that appointment with their oncologist really forever. So it is not uncommon to hear that. So thank you, Karen. Kristen, can you share a little bit about your experiences and some things that stand out to you that you think the audience might like to hear?
Absolutely. So I was diagnosed in December of last year with stage 3 ovarian cancer. For the whole year leading up to my diagnosis, I started to feel unwell, but not unwell in like a normal person would feel unwell. I started to get, abdominal pains in March of 2020, right when the pandemic hit, and I was laid off work. So I started to chalk those pains up to, stress of the pandemic, not working, being more sedentary. I wasn't at my job. And I kept telling myself that that's what it was. It wasn't anything serious, because it was never the same intensity. It was never the same side. It was never the same duration. Nothing ever aligned up to be the same. Then I went back to work and the pains didn't stop. So I, again, chalked it up. It's the pandemic. It's working in a childcare field with the unknowns and the kids and, the whole stress of the pandemic. So I kept chalking it up to that, but they didn't go away. So finally last June, I contacted my GP and I said, something isn't right. I have these pains. It's not going away. So I went in to see him and he's like, I can feel something. I feel something there. It feels like an ovarian cyst. I'm like, okay, an ovarian cyst, that's treatable. That's nothing scary. So I was sent for an ultrasound almost a week later, and that's when they found the first mass. Then they sent me for a CT, and that's when the second mass was found. My masses, I call them masses because tumor sounds scary. So my masses were quite large. One was 15 centimeters long by 6 centimeters wide, and the other was 13 centimeters long by 4 centimeters wide. So they were quite large. I immediately met with a gynae oncologist, coming up with a treatment plan because it was ovarian cancer. My treatment options were very limited. They gave me the choice. I could keep one tumor in and one ovary and hope that they could find some viable tissue to extract some eggs, and potentially have, my own children someday, or take both tumors, hysterectomy, ovaries, everything, and essentially be put into menopause at the age of 34. I chose to give myself the best chance. I chose a complete hysterectomy. Making that choice within 1 week was not easy. It altered my life completely. And November 8th, I had surgery. Surgery went really well. I was out of the hospital in 3 days. I was home recovering, thinking positive thoughts. It's not cancer. It's, if it is, I don't need treatment. It's going to be great. And then December 16th was my first treatment. They told me you need to do 6 rounds of chemotherapy. And that's what I did. I did 6 rounds of chemotherapy, and I finished April 1st of this year. And on April 16th, they told me I was considered no evidence of disease. So,
Whoa.
I'm not sure. There we
Disappeared like a magician there. Look at that,
Apparently.
Kristen. Someone of many talents. Yeah. Okay. Sorry, did you want to finish? Were you still finishing
Nope,
your
that's
response?
it.
Okay.
I'm considered no
Well, it's
evidence.
perfect timing. It's just like, yeah, it's interesting sometimes having to find different terminology. Something that stood out for me, how you use the word mass rather than tumor, and some people just do different things because it can make the way we feel about the cancer, make it feel different inside of us. The words we use to describe it. So the question I want to jump to is acknowledgement of the question that's in the Q&A. She really resonated with Karen in the sense that the situation is like pretty much the exact same, but at a different time frame. So we're going to jump to the fact that both of you have been out of treatment for more or less 6 months. And there are people in the audience today that are not in the post-treatment phase yet. And we also want to acknowledge that some people do take treatment for the remainder of their life too. But in terms of the last 6 months in the post-treatment phase, are there lessons learned? Are there things that surprised you in the post-treatment phase that you would want to share with the audience? And Karen, I'm going to let you go first.
Sure. Yeah, I am way more emotional than I ever was before. Once you're done treatment and surgery, or surgery then treatment, you kind of think that things go back to normal. And they do, but in a very different way. It's a new normal. And I found for myself, I am navigating this new life that I didn't think I would ever have to go through before. So, I found I look at things differently now, having gone through what I have. And I try and remain a little bit more positive, but at the same time, to be completely honest, I don't have a lot of patience for things that I used to maybe be a little bit more patient with before. Not anymore. It's sort of like, you know what? I didn't fight this hard to get through everything I have, to be tolerant of certain things. And so that can be a good thing and it can be a bad thing. But it's, yeah, I would say probably very more emotional than what I was. And, I have used our wonderful CancerCare resources. I signed up for a breast cancer support group and met some fabulous women and a connection like I've never had before with people because they got it. Friends and family have been fantastic, but these women get it. And so that has helped me through my journey in healing. And, meeting with a cancer care counselor and just talking through life, and emotions, and knowing that everything that we've gone through and continue to go through is all normal. And normal looks different for everybody, and that's okay.
Thank you, Karen, for sharing all of that and sharing that experience about the peer support group too. I don't think there's any true replacement for like good peer support if that's something that fits your personality. And I see Kristen nodding her head as well too, so I'm setting her up a little bit. But Kristen, did you want to talk about what it's been like post-treatment for you?
Absolutely. I mirror Karen 100%. I am more emotional. I take things I don't take things lightly, but things affect me more. I feel like pre cancer diagnosis, I was complacent. I didn't want to upset anybody. I didn't want to rock the boat, as it were. But I didn't, like Karen said, I didn't fight this hard for my life and for my future to just let things slide anymore. So I feel like I'm more outspoken. I found a wonderful community, the young adult cancer community, with Young Adult Cancer Canada. They have weekly chats, virtual chats that you can log on no matter how crummy you're feeling, and talk about different topics with other young adults who just understand what it's like to go through cancer as a young adult. And doing those web chats weekly really kept me sane, because I couldn't see my family, I couldn't see my friends. It was in the midst of a pandemic, and nobody wanted to make me sick because I had no immunity, and I completely get it, but it's also very isolating. So having that community was phenomenal for me, and I to this day I continue to meet with those people, and I've made friends all over the country, all over the world through the cancer community. And it's just, without them, I don't know if I would be as uplifted as I am today.
Yeah, thank you so much for sharing that. I do want to ask you, Kristen, while we're on the topic, are there one or two things that make it different being a young adult having cancer? This is a topic that's near and dear to my heart. But did you want to say more about that?
For sure. Yeah. So Ian was actually my counselor through CancerCare, and he talked me through many aspects of what it's like to be a young adult with cancer. And it hits differently when you are a young adult. People often say you're too young for cancer, or you get those weird looks when you're in the chemotherapy room, and from the others that are sitting there looking at you like, why are you here? Um, you have you have to really decide your entire life in a very short period of time, when the others in the like in the chemotherapy room have figured their lives out, and here you are facing the biggest fight you'll probably ever fight in your life, and nobody there understands. So finding that community of young adult cancer survivors and thrivers, it was super helpful. Super helpful.
That's great. Karen, a lot of people on the call today may have noticed that I use the word advocate in your bio, right? So, what advocacy means in the cancer world can look different. So, I'm wondering what it looked like for you, and what are like some subtle and not so subtle ways that people at the presentation today might want to learn to become an advocate for themselves.
Thanks, Ian. Stand up for yourself is kind of what advocacy means to me, and the way I put it in action. And for those of you that have the same name as me, Karen, you get lots of memes around somebody that doesn't take, pardon the language, but doesn't take shit from anybody. And really, it was, for instance, being told that my mammogram was going to be 12 weeks, pardon me, not 12, 6 weeks, after I first went to the doctor. And I thought, I'm not prepared to wait 6 weeks. And so I called them And she said, we don't have I said, can I be put on a list, a wait list? And she said, we don't have that. She said, but you can call back. And I said, okay, I will call back twice a day, every day. And she said, that's perfectly fine. And I felt so terrible doing that. But I thought, no, I need to do this. I need to move things along. And so I called. It took 3 days of calling twice a day. And I was able to get an appointment a week later. Going through appointments, there's so much information that's shared. And so I was so fortunate that my wonderful sister was able to join me with the oncologist, with the surgeon, and was able to hear things that I couldn't at that time, recording conversations with the permission of the doctors so that I could listen back. And I think the biggest thing too was writing down questions that would come up so that I could question the doctors. If I had heard something, seen something, was just questioning. And so it was really being that focus on myself. I usually focus on everybody else, and instead I focused on me and what I needed to do to make it through.
Karen, that's a really nice segue because you're talking about people being a second set of ears for you and like some very emotionally packed appointments that you want to be able to remember things in. And there are patient family members and there's supporters and caregivers on the line too. So pivoting to Kristen, what advice would you give to those folks in terms of what kind of support that you found most helpful, knowing that everyone's different? Because a lot of times there's a fear of doing the wrong thing or saying the wrong thing. So what would you say to the family members in the audience today?
For me, it was most helpful when people just talked normally to me. Yes, I was going through something super terrible and super scary, and something hopefully nobody else will ever have to experience. So having my friends and my family talk to me as I was just a normal person in that moment, without my hair, bloated and feeling like garbage, talking about the mundane things like, what they watched on TV, being that person to just listen to me when I was feeling awful and I just needed somebody to hear what I was saying was definitely the most helpful for me. I needed, my husband was the most wonderful support I could ever have imagined. He advocated for me. He was there when the doctors were telling me it was cancer in the hospital. And I remember laying in bed after surgery, still out of it from all the meds. And I remember the doctors telling me it is cancer. And I don't remember any of the other conversation. I asked him about 4 times the rest of the day, what did the doctor say? Tell me, what did they say? What is it? And he repeated it over and over and over again for me so that I could remember that this is what happened. And without him, I don't know if I could have done it. He gave me meds. He, fixed our bed for us. So he lowered it and put a rail on so that I could get in and out of bed and I didn't have to sleep on the couch after surgery. He was my ultimate support for sure.
That's great. So we've only got a couple minutes left in this panel, which is breaking my heart because I could go for another hour and a half. But and it looks like you two could as well. And I do want to encourage you, if you feel like multitasking, there are some questions in the Q&A. If you feel up to answering them, you don't have to, but there's some questions and answers in there if you see them that you can choose to answer if you wish. But I'm going to keep asking you questions, so it's going to require multitasking. But I guess really what I want to close with, though, is finish the statement for me. If I knew then what I know now, if I knew blank then, and now I know this about it, what would that be? Like, it could be any aspect related to your cancer experience. And Karen, I'm going to put you on the spot to go first.
Okay. Oh, if I knew then, what a big thing would be, that I can get through it. Because when it first happens, you don't necessarily know if you're going to do it. and you just keep pushing on. And I think the other thing that I would say is ask questions and learn as much as you possibly can, so that you can make the right choice for you. What's right for me may not be right for you, because our journeys are always different. But ask questions and learn as much as you can so that you're well informed.
It's lovely, Karen. Thank you. Kristen, 30 seconds. Go.
If I knew how hard recovery would have been, I would have done more during treatment to make set myself up for success. Treatment is hard. Treatment is hard, but recovery is equally as hard. Treatment, you kind of fall into a pattern. It's meds, chemo, recovery, repeat. And recovery is, why does this hurt? What's this? What's going on? Is this cancer? Is this, all these unknowns that you don't necessarily have the answers to. So if I had known about recovery during treatment, I would have set myself up for more success, for sure.
Okay, thank you so much. And thank you so much to both of you, Kristen and Karen, for sharing your wisdom, being very open and vulnerable here on the panel. And I think the people in the audience really benefited from hearing from you. Thanks, everybody.